through educational activities, projects, etc. Ksenia, would you please move to the next slide? Yes, thank you so much. And the main focus of PASTE is, of course, on the development of communities and expertise in different countries. So a part of our activity is always connected to bringing some colleagues to share their expertise, their success stories, questions, and cases. Not so long ago, our colleagues from Kazakhstan, they shared the experience of creating the support center. We have this recording in the YouTube channel. And if you have some experience and expertise to share in the future, please share these requests with us. We are very, very welcoming towards all those initiatives. I think the expertise should be coming not only from the outside of the region of our work, but also from the inside. Apart from that, an important idea is that this webinar is in both languages, English and Russian. We have 2 audio settings. And if you find it more convenient to hear in English, please switch your channel to English. There is the special globe or translation channel. You will hear the English line of stream of our webinar during the whole workshop. The recording will be given in both languages, English and Russian. What is more, if you understand that some materials that PASTE is done would have been helpful to move on towards the spreading of this materials, please let us know. We are prepping the translation of some helpful texts and sometimes even books into the languages of the countries where we work predominantly: Armenia, Georgia, Uzbekistan, Tajikistan, Kyrgyzstan, Kazakhstan, the countries of Northeastern Europe, Latvia, Lithuania, Estonia, just in order to spread this knowledge. This webinar is not meant to be a monologue type of webinar. So please, let's make it a dialogue. Please share your comments in the chat. It's very important to share several experiences during this webinar. Why it's so important, I'll share that with you very shortly. I hope if you find it interesting what PASTE is doing, and if you want to join those educational activities, please subscribe to our newsletter on our website. We have the chat for experts of palliative care from our region of presence. And please join the chat, and you will be able to be in a closer contact with the community. In the chat, in the Zoom chat, you'll have access to the link through which you will be able to fill in the review and get access to the chat. I'll be super happy to announce several very exciting events which we are planning in the future. But now let's move on towards what we have today. The webinar is going to be interactive, and it's going to be organized by my colleague. His name is Felix. He has great experience with volunteers. He does medical and non-medical volunteering coordination in hospices. And I think it's a great pleasure for us and for many volunteers, for many organizations. It's a great pleasure to coordinate with Felix, because he knows really well how to support volunteers, to support the patients, how to support the medical personnel, etc. So Felix is going to host us today, and he will be able to share his experience in a very interactive format. So we've conducted a survey, and we understood that everybody needs volunteers. And about 60% of our interviewees already started working with volunteers in their medical institutions. 67% of the colleagues mentioned yes. I'm sure you guys also have some very positive cases, or maybe questions which are not solved yet. We'll be happy if you also share the information during this webinar once we have this platform for the interactive dialogue. It's a very long way to build this community, of course. And so I would say that one of the interesting points to mention that could potentially be a question for our collaboration is that all volunteers come from time to time. Of course, despite the fact that 100% of the respondents need the volunteers and 67% already work. Now, it's important to understand whether this is clear on how frequently you can let your volunteers join the activities. Another important moment that colleagues mention, colleagues who work in hospices and other institutions, they share that the work with any volunteers, with any staff member, with any personnel, it's a separate task in itself. And if you have volunteers who are not fully engaged in the organization's activity, it's an even more tricky challenge for the staff members to coordinate volunteers. So you face very different situations. Sometimes institutions have separate coordinators. Sometimes there's just a staff member who has other functions to perform, other job duties. And of course, sometimes there are situations that volunteers are coordinated by different people in different departments and there is no designated function. If you faced a similar situation, please share that during the discussion that we will have. How are we going to build the discussion so that it will be easier for us to explain that in the future?
То есть это не просто ответы в пустоту, мы все это собираем.
We will use the software called Miro, which will be important for us to use so that you will be able to interactively participate at the moment, use the sticky notes and share your comments during the discussion.
Но вы не готовы это делать публично.
If you understand that you would like to share the experience,
личное сообщение и, например,
but not do that publicly, you can always share a personal message to some team members. All of our team members have names and comments. I'm sure it's going to be very doable and easy. So please share the comments in a private message. If some technical details arise and if you find it challenging, please comment in the chat. We'll try to fix it as quickly as possible. If you want to comment something during the discussion, please use the block called reactions or emojis. There is another button where you can raise hand, thanks to which you can raise a hand. And please let me know if you have any questions left. I'll yield the floor to Felix, and I hope to see you at our other events as both as participants and speakers, and perhaps as the initiators of some partnership events. Felix, the floor is yours. Thank you, Anastasia. Thank you very much. Let me now share my screen and we'll get started. I hope everybody hears me well. Yes? There is a small setting to be done. Do you see my screen? Only the demonstration so far. We can see that. Oh, here we go. Yes, now it all works perfect. Let me juggle between the screens. Okay, now all good. Thank you very much, dear colleagues. As Anastasia has mentioned, we'll move on towards the interactive part of our activity. I'm not going to share about the volunteering in principle, in general, but I will be asking questions. And you have the chat and you have the microphones. You will be able to answer, and my colleagues will also help me note that down. And we'll try to create your perfect volunteers image and get some clear definitions of the expectations. Let me say a few words about myself because I'm the host of this event, so I can do that. I'm 30. I've been working in the foundation called Vera for 5 years. Now I am a PACE coordinator. I am also the organizer of volunteers work in the fund called Interculture or Intercultura. I was the coordinator of the first Moscow hospice named after Vera Milyonshikova. And I also participated in the methods of non-medical care for patients. I coordinated more than 100 people who helped the hospice. I collected all the information and accumulated all this information and sent it over to volunteers. Those were different tasks. We'll discuss them later. The coordination between the volunteers and the medical staff, it was a very challenging task, you know. The volunteers are someone from the exterior surrounding. There are so many medical people who have never worked with the volunteers, and there are some volunteers who have never even interacted in a similar fashion before. So together with my team, what we've been doing together with the hospice team, we've been doing different events. It was a part of my volunteers work. We had cat and dog therapies, workshops, individual classes, and, all sorts of limitless activities, I would say. I would say that the work with patients is very tricky, but it's very important to understand what kind of help is needed to a patient. Sometimes the medical doctors helped me to understand that. Sometimes I tried to understand that myself. And I also interacted with the relatives of patients, because sometimes, as you know, a patient may be very sociable, sometimes vice versa. Sometimes the relatives are grieving and they need more help. Sometimes a patient has already died and we may need to help the relatives. It's also a part of our hospice work. Let's move on. A few words about history. And I'd like to say that I want to start with the quote. As you know, hospice movement as we know them were born, I'd say 50 years ago, perhaps, thanks to this fantastic woman. I'm sure you know her, a nurse, social worker from the UK, Cecilia Sanders. She has created this term called the joint pain or the common pain, encompassing pain, depending how you want to translate that. It not only includes the physical pain, but it also implies emotional, social, and spiritual pain, because the person may be sick. They understand their prognosis, they understand their diagnosis. They are unable to stay in the same position because there is the question of faith or the question of, internal setting. So with all these things, hospice can help. And I'd like to say, the same position that there is the question of faith. It's also a question of, I would say, the best doctors, the best people come, the best nurses come to hospices. And I'm so glad I can work with these fantastic people because, for instance, surgery has been working for thousands of years, but the understanding of palliative care, as we know, it is very, very new. I just said it's only 50 years in the UK. In our countries, it's just about 30 years. The volunteer movement is just about 15 years. In the structure where I worked before, they started thinking about volunteers about 15 years ago. They started working with volunteers about 10 years ago, and the properly working structure only appeared about 5 years ago. That's why it's the process which we need to start. It's complex and challenging. It has lots of tumblestones, but it's very available if you start. It's a process and you need to understand it. Let's move on. What we need to understand that non-medical care in palliative care is very, very important, integral part of palliative care. It may be legal support, social support, and spiritual support. So volunteers help as well, very, very much. Volunteers are extra hands, extra eyes, extra hearts, extra ears, who together with doctors can make it much easier for patients. When there is painkilling already, but you still need some support, for instance, walks, theatrical escape nights, dentist visits, etc. And volunteers can really, really help very well. Let's have a look at the aspects that I think we should pay attention to. I'd like to start with the legal issues. The people recall about it only in the very last moment. Lots of people say, yeah, we want to have volunteers, please come help us. But very few people ask a very clear question about the legal basis. If a medical institution is ready to accept volunteers, then, for instance, in your country, do you have a law that regulates volunteering or charity activities? How can you call people? On what basis? Are there any specific legal rules that frame the whole activity? Can you welcome the volunteers to this activity? Perhaps you as a medical doctor, you want to have volunteers on board, but your leadership is scared of some complications for this activity. you may be in doubt, and you need to clarify that from the very start, the legal aspects, before you welcome anyone. There are also some questions of contracting volunteers or charity organizations or non-governmental organizations. Very often we have legal responsibility. And even though volunteering is something that a very much act of will, it's still done in goodwill under the certain regulation. Volunteering should be done not just by default. It has certain rules that need to be followed. And for instance, the question of medical papers or reporting that should be provided by volunteers in case a volunteer enters the doors of the palliative care institution. Very often kids have low immune system functions, and we of course don't want to make the situation worse for them by bringing extra bacteria or something, virus. So very often, in case of my experience, we needed all volunteers to have certain examinations or tests done, for example, the chest X-ray, etc. Let's speak about volunteers themselves. For many years, I've been a volunteer myself, and I very easily and clearly understand the psychology of volunteers. A volunteer comes to help, but not to make somebody's job. Very often it seems that a volunteer will come and they will do everything for you. They will be like an extra pair of hands. Not exactly. They come to assist, they come to help with their hands, with their mind, with their heart, or some other activities. But it's important to understand that it's not his job to perform a certain activity from A to Z. Volunteer comes from the verb to volunteer, and that's important that they have their own reasons to come. Many people really just want to help someone. For someone, it's a question of closing their psychological questions, or they couldn't take care of their mom, grandfather, or grandmother at some point when it was right time. For someone, it's serving, of course. Everybody takes it differently. But anyway, it's free and it's a goodwill. A volunteer has his or her own life, family, work, hobbies, etc. For some volunteers, I'd say it's just an extra activity. They can easily forget about things like the volunteering activity when they are at home and in the family. It's important to remember that they have other priorities in life. They're very simple people, and they don't need to run after chasing your task 2 minutes after the call has arrived. And moving on to the questions which I would like to discuss with you. How do you think, dear colleagues, if you have your microphones on, I think it's important to understand the question, where, in what aspects of your work volunteers can be helpful. Let me switch to Miro, and I hope you can share your opinions. Maybe somebody would like to switch on maybe someone wants to switch on mics and just share your thoughts. Hi, Felix. May I just share a very quick housekeeping rules? Unfortunately, we don't have the chat working properly, but we have questions and answers section. I see. Okay. The chat. Who wants to share? You can just raise a hand and switch on the mic, and we'll definitely note that. The microphones are, I can see PC Nick wanted to switch on the microphone. Colleagues, please introduce yourselves in any language that you like. English, Russian, doesn't matter, whatever.
Good afternoon. My name is Victoria. I'm from Moldova. We have a public organization that offers palliative medical care at home and also in a daily clinic. We did have a practice of working with palliative patients when we just started, and we also worked with volunteers when we just started, and we work with them up until now. We invited volunteers from some educational institutions. For example, we have a medical college, and there are students that also wanted to help us as volunteers. They could clean the houses of our patients, also could buy some medicines in the pharmacies. We also had a small project when we were celebrating the World Day of the Child Oncology. So we were also working with the school students, and they could collect some interesting books for our children, patients. They could also make some toys for our children, or children could bring some fruit. They were also writing letters to support our patients. And so at that time, it was very interesting because we didn't have a car. And we just ordered a taxi service. And we said that we are representing this project and we have 30 patients, children patients. And this taxi service took care of our patients and brought everything that was needed to them. They also chatted with them, communicated. Okay, so do I understand it correctly that like your volunteers were helping you both at homes of your patients and in the clinic? Or mostly at home? Yes, mostly our volunteers were helping at home. And what about the clinic? We don't have any clinic yet. That's why we don't have volunteers. I would also like to ask an additional question about school students. As far as I see lately, there is an interest from school students towards volunteering. Did you train your school volunteers anyhow specifically? Did you explain to them that they would see children with some particular life situation? They were only collecting the gifts and the presents that we later gave to our patients. So they weren't really in contact with our patients. And our nurses, our doctors did that. And they also went to the department, the medical department, where our patients stayed at that point of time and gave some presents. So the school students didn't really communicate with our patients, pediatric patients. We have a law regarding this and everything, and there are a lot of requirements. We need to sign a contract. We need to write down the functional responsibilities, also to assign the person who would be responsible for this. And so we work with volunteers from time to time. They spend some time with us and then just continue their life. Okay, thank you very much. Then I would like to announce our next webinar, because you said that sometimes you can also use the services of some companies like taxi service that you used. And if the volunteering unit is not in contact with patients, then it also works, because volunteers can be just gathering, collecting gifts and presents. Also, fundraising is a very important one. We will talk about these topics later. So if there is any interest or if there is any experience, please connect to us, approach us in a text message or in any other way. Thank you very much for your comments, and the city where you're from is very, very beautiful. We also organized a market, a winter market, and children were making New Year's toys, New Year's decorations. And we've already had a booth, a stand at the market where we could put our gifts. And we didn't actually sell it. We just explained to the visitors of this market that we're not selling this, but our volunteers, children, made this for our oncological pediatric patients, and that the visitors of the market could just take a toy, a decoration, and just maybe leave some money for this. It was up to them. And so that's how we organized it. Okay, thank you very much for this experience. Thanks a lot. Is there anybody else who would like to share how volunteers can help? Okay, I do see that we have some problems with our chat, but we also have a Q&A function in Zoom. You can write your questions there, or you can also unmute yourself and comment. Sophia, please, the floor is yours. Yes, hi. I'm from Belarus, and I represent Belarusian Children's Hospice, and I was coordinating volunteers. I was also a volunteer myself for quite a long time, and I completely understand what Felix was mentioning. I just wanted to shout yes, like yes, yes, I understand this. We have a program. It's a summer camp. It's still functioning, where a lot of work is done by volunteers. This is the project that wouldn't be able to function without volunteers. So we have a social worker, we have a nurse on shift, and we have volunteers that are assigned to the patients, and they help them for about 2 weeks. But it's quite a difficult one, because it's difficult to find a volunteer for 2 weeks because one has to take a vacation or something. But this year, and you also asked about school students, at one of our main shifts, we had volunteers aged from 15 to 16 years. We also had to have male volunteers. It's another problem. And how we addressed this, we asked their parents to sign an agreement, a consent, that they allow their minor child to go to our summer camp and to volunteer there. Because in Belarus, there is no law on volunteering. It was being drafted, and we were involved in this process. We commented on this, but it never was brought to life up until now. And we have another project which is called A Friend of a Family. It was made specifically for volunteers and their families. Now we don't have any clinic, and we just have the government-owned palliative centers. And here, of course, we focused on communication. Some patients also ask for some help, but we really would like to build the to establish the boundaries, to prevent the volunteer from feeling being used, because we also need to establish some framework. And when I was coordinating volunteers before going to the camp, or before a volunteer would come to visit a patient at home, then I also asked my colleagues to explain all the nuances of this work to the volunteer. And we also organized some charity events where our volunteers weren't really in contact with the patients, but they were just helping to fundraise. In the past, it was more often, but now it's less often. We organize some social events involving volunteers as well. And well, our volunteers were also responsible for some specific functions, such as, for example, tea, coffee, something else. So those were their responsibilities. That was the main that they did. Okay, thank you very much, Sophia. That's very nice. Are there any other comments or questions, or maybe you'd like to share something else? If you don't have any experience working with volunteers, it's okay. Maybe you have some idea, or maybe you have some concern about this. If we don't have any questions now, I think that we can move on, because you see all the questions on your screen, and if at any point of time you want to go back, then we can definitely go back to the topic that we discussed. Okay, thank you very much. So the floor is to Felix. Yes, thank you, dear participants, for speaking. I see that there is an interest, and I see that there is some common ground which can serve for us as a foundation for our further work. Thank you very much. And now I'll get back to my presentation and we'll continue. And we'll get back to our main question. Can you see my presentation now, dear colleagues? No, not yet. Now we can see it. Okay, great. So where can volunteers help? Well, I would like to say that volunteers is like gas resource or water resource. So where help is needed, they can actually help. So as to the main criteria where volunteers can help, let's take a look. They can solve some administrative and organizational issues. I think that this is the major task. Well, I think that if you send an unprepared person to a patient, this is not really a good thing to do. So volunteers can help you in administration tasks and organizational tasks. For example, they can clean, they can take care of plants, they can clean the wards, they can take off the dust, clean the toilets, they can also paint the walls, help with the garden, take care of flowers, and like the list goes on. They can also make some special plates, maybe help with paperwork a little bit. Also, sometimes we need to number the logs for your medicines. Volunteers can do this as well. So everywhere when or where the manual help is needed, volunteers can help. And also, another one is that volunteers can be also in communication with the patient or with their relatives and be active listeners. Quite often it is really needed, because I work with adult patients and I see that elderly people really want to share. They want to talk about their life, and they don't have anybody to talk to because, for example, they spend some time at home, a couple of years, and then a patient got into the hospice, and now it's the opportunity for the patient to talk, to speak, to communicate. And so this is very important. The third function which volunteers can carry out is the organization of events. There are some patients who haven't been out for a long time. They haven't been to any concerts, any events. They didn't do anything. And it would be very nice if a volunteer could organize some workshop, clay workshop, some drawing workshop, anything. Also organize some event with dog therapy, cat therapy, etc. And the last one here is the help with feeding and conducting some hygienic activities. If you trust the volunteer, then he or she can be of great help, changing diapers, etc. Also, when a patient needs a shower, take a shower, a volunteer can help you as a caregiver to do this. If you trust this volunteer, so you'll be a team. And I would like to also mention something about feeding and some hygienic procedures. Well, of course, we are not talking about patients that need some additional care, but if a patient can swallow quite easily, and if a volunteer knows about the rule of three, then the volunteer can help. Also, a volunteer can help to dress a patient for a walk, etc. So if your volunteer is trained, and we'll talk about this a bit later, this volunteer can save you a lot of time, a lot of effort, and he or she can also save your back, because like people who work in hospices all have problems with the back pain, and so volunteers can help here. Okay, let's move on. And our next question, who can become a volunteer? Who are these people who can do this? Maybe you have some suggestions. Maybe you have some ideas. If you could voice them, that would be really nice. Who do you think can become a volunteer? And I would like to add also, says Anastasia, who can't become a volunteer? We've already touched upon this. It was already mentioned by our colleagues from Moldova and Belarus. They were talking about school students, medical college students, and also some people, for example, that work in some organizations that offer some volunteering help, like a taxi service. So let's start with Sophia this time, and then we'll pass the mic to Moldova. So we will proceed in a different order. Sophia, the floor is yours. Okay, yes. So I've already written in the chat that those can become volunteers who have the desire and the opportunity. Both these two components are very important, but sometimes people have only one component of this, but it's not enough. Mostly they should be adults, but also minors sometimes really want to help. And we also had pensioners volunteers who wanted to do something. So I think volunteers can be people who really want to give their care and give their time to somebody. Okay, thank you very much. And is there anybody who can't be a volunteer? Maybe there are some reasons why a person cannot really become a volunteer. Well, I can't maybe remember immediately, but I think we had some people with some psychological problems and they worked for a very limited period of time. Okay, I understand, yes. Okay, and so our participant from Moldova, we had an experience when we had invited performers from our city, and we had an opera singer, and we organized concerts. And when they came to us, they were also bringing their friends, also performers, some actors, so people from the art world. And those were great events. We had a full house. We've sold all the tickets, but it was quite a work to do. I had one volunteer He was the director of our House of Culture or Palace of Culture, and he was just driving me around all the events, and we were coming to different events and talking about our work. And what I would also like to underline is that this work should be done by people with a good heart, good people. It's very important because these people who actually give care, they can be quite lonely, who can even like have family and children, but quite often they are abroad. And of course, like our patients also need this love because quite often they are lonely as well. And it has already been mentioned, it's very important to listen. Thank you.
There comes one more interesting group of volunteers when people come based on their professional skills. So they perform one of the functions that Felix has mentioned, for example, being a partner to spend some free time, or I think also you mentioned that in your first monologue, there are some medical college students, those who have some professional skill here in order to help people get some diversified leisure time. It's not just that people have some experience, but those are, singers, musicians, anyone who has a certain skill and the skill is needed, then I think that's a perfect match. Does anybody else want to ask a question or share something? Go ahead. If not, if you don't want to write comments in the chat, then Felix, I yield the floor back to you. No pressure to share. Feel free to do that later in the personal messages or later, even in several months, up to you. Back at that time, we heard this and that, we tried this and that, we would like to discuss this and that again. We will be super open to that, and PASTE is here for you to help you with the knowledge in a broader sense in palliative care, knowledge in palliative care that you might need at a certain point of time. Yes, thank you. Thank you for your answers. I think you took my text and you just literally announced that for me. Yes. Who can be a volunteer? Pretty much anyone. Any adult, mature person can definitely be. But we all live in very different contexts and very different situations, countries with very different opportunities. So I'd say the criteria that you set will be right for you only. What you announced matches very, very much, resonates very, very well with the experience that I have. And yes, perhaps adult 18 plus year old people who are ready to be responsible for their actions and who are responsible in general. And Anastasia has highlighted very well who cannot be a volunteer. I'd like to pay your attention to that. Yes, please pay your attention to the following criteria. The candidate intends to volunteer in order to promote their ideas. Well, this matches very much about the religious organizations. In my personal experience, of course, I interacted with some religious organizations, but when a patient is being promoted a certain idea, that's very tricky. When a candidate is not able to keep private information private or secret, that is very tricky as well. Medical secrets should be kept secret. Or a candidate has lost a close person no less than a year ago and is still grieving. It's very important. Many volunteers are our ex-friends, colleagues, etc., who lost a person in hospice. Very often that happens. It's these are good people, fantastic people, and their energy may be easily used, and they are super happy to help very often. They're happy to help other patients, but you need to wait a little bit so that this grief is worked through. Because when a person comes right after the loss, of course, it's very challenging, and there is this transition that happens. Sometimes they cannot help in an abstract fashion. They always see their mother or father in the eyes of the other people. Children's palliative care, same story. Before we proceed, the pictures that you can see, they're all coming from hospice. This is a dog, volunteering dog. For example, here you can see our patient. She had an interesting story, like all the pictures, they had fantastic stories. She wanted to read Plato, and we didn't have any Plato books in our library, and the volunteers brought their home books, so she was very happy. About those people who can and cannot become volunteers. The question is how we select these people. There are very different structures. I'm not the smart one, so I read a lot. I'm not the smartest one, so I read a lot of books. I will give you a list of literature that sources that will definitely help you. But here comes a scheme. How a volunteer may be selected. It's in English, but I simplified it, translated that, and I made it simple this way. We have a certain application, can be a Google form or anything that you can see in this table. Those are specific recommendations. Many Western hospices, it is very requested that you have a recommendation or a reference letter from someone. I think this is extremely important. This what we should strive for. We're not just accepting anyone, we are selecting the ones who can help us. This is extremely high responsibility, and it's a very noble job to do. So not everyone can come and help. I think this is what we should strive for, and we should understand the importance of the job that we are doing. The other thing is about the interview, especially if we look at the British or American applications. There is this an onboarding, an introduction. You should teach a person to explain how a hospice works, etc. This is very important, how people see that, how people understand what hospice is. This onboarding is critically important. And then there is a trial period. And if the trial period doesn't work well, then you can easily say no if the person doesn't match the criteria or didn't overcome certain challenges of the first hours, or the first days and weeks. I'm so sorry. I followed this system, I followed this patterns, and this kind of funnel, it really helps. You can see that the rejection is very, very doable. Later we can discuss that as well. So let's move on to the next question. How can we find a volunteer? You've given us a lot of questions, and I'm super glad that these answers were announced. You've been doing that for many years already. Let's move to Miro again. Perhaps I will listen to your answers. I will hear your answers. We have so many aspects here. I see lots of aspects, that's right. I'd like to highlight a couple of things. I'd like to ask you a question, actually, a clarifying question. You mentioned that there are school students, professional singers, musicians, etc. Those are types of groups that you address. But those who haven't worked with volunteers yet, they ask a question: how do I establish this contact? For instance, I have lots of tasks, so I need Plato books, I need journals to be written. How do I start the contact with whom? Who are the right people to address? Sometimes it may be scary. How can I approach someone and just ask, come over, help me, etc.? So should I remind somebody of death again? Of course, there are people who bring us hand by hand. They usually bring their friends and relatives, etc. But that doesn't always happen, that friends bring other friends. So the question is very often, how do you approach the first contacts? What are your first steps? How do you find those relevant groups of potential volunteers? If somebody's ready to answer this question, I see Sophia she always has her hand raised. I don't know if, yes, I see maybe you are ready to share. I guess you could possibly have these issues at the first contact, maybe the school children or 15, 16-year-old young adults. Okay. Yes, I can comment on that. I forgot to pull my hand down. I'm so sorry. I just didn't notice that. Yeah, I can comment on this. So even when I approached the first hospice volunteering activities, we had a certain funnel. It was all there. There was an opportunity to get this questionnaire in the website, and sometimes we had those young adults, 15, 16-year-old, or sometimes what happened was that moms and parents approached us. And so we had a lot of word of mouth, I would say, when somebody was recommending their friend or someone else. This year, for instance, last year, we have started following the Russian experience of the so-called lessons of good actions or lessons of goodness. We've been doing those classes to some very little kids. So even them, they approached as well. So very clearly when it came to universities, yes, we approached university groups. Sometimes we talked to a provost or a dean, someone in the top of the university, who gave us a chance to talk to students during their classes so that we could share about our activity. That's how it happened. Right now, a lot of people come through the applications, etc. There are two important moments here, so that the person could hear something about you somewhere, doesn't matter, at school, university. And then second point is that they could announce their desire, their willingness, so that they could fill in some application. Very often this is so challenging. You're writing a letter, but you're not getting any answer, or when you're getting the answer, they lose their patience, they're losing their passion. This importance of a relevant, clear link, how people can apply, is very clear. I think it's a very clear threshold for many. So let's keep this in mind. Are there any other comments? Yes, Sophie is writing that this is correct, that this is happening sometimes with the application processing. Yes, this is very much connected to what Felix was saying. This is all about the management of this process, right? Because, yeah, very clearly, when we have these tasks to do the pain killing and etc., and suddenly if this person works with volunteers, then they probably do pain killing to patients first and prioritize the work with patients rather than the work with volunteers. So this management of process, this process building is critically important. Well, if we have no more comments, then let's proceed. Felix? No, I can. Yes. Yes, thank you so much. I saw interesting that what you guys mentioned, the help through children or students organizations. It's true, it's interesting. I very much love events related to schools, etc. I don't know why. They are somehow very cool. It's interesting that it works well for you as well. Colleagues from Moldova mentioned that, and now from Belarus as well. It's interesting that this practice is that's pretty cool. Let's go through the basic points where you can search for volunteers. You guys mentioned many, but still, there are some local NGOs, of course, that are ready to help. If there are there or not, we don't know for sure, but this intra-organizational cooperation is critically important. Sometimes these are very important, that's true. But if you have a big activity, for example, some, I don't know, important renovation, And there are also organizations, communities that are ready to come and do some activity once in half a year, for example, or once in half a year, for example. That's very doable, right? People have gone through a similar experience. I think in social networks, you can also search for volunteers. It's not exactly the best way to recruit volunteers very often, but it's a really great way to do fundraising. It's a different topic, but still. People who went through a similar experience, this is a great resource, but at the same time, huge responsibility. Because these people, as you said, they may be unstable financially. That's why with them, you need to work a little more. Social networks, huge work in social networks. People love those stories. People love stories from hospices. People love hearing about those stories. They want to be connected to those stories. They want to be a part of that. And if you can do that, and if you can speak about that, it's a huge pile of work. And as I mentioned, this is fundraising or attracting some support or donations. Also, the recruitment of extra sets of hands. If you do events, for example, as well, the events with school children, with medical colleges or anything, if you have a chance to attract media, write in social networks, promote your word, it's easy for PR to move on from that point. Special program campaigns. Many companies have their social responsibility programs, social corporate responsibility. For example, company A has a budget so that their employees would come and do some charity once every 6 months. That's very possible. You may track these organizations and see if they have such programs. We've worked with huge legal companies, with many others, actually. People who in their regular life do paperwork. In the regular life, they do some IT work, but in their free time, they came and did some street cleaning close to hospice or garden cleaning or anything. This is very, very helpful, both for your patients' work and also for your infrastructure. Maybe remodeling of your building, or maybe fence fixing or anything. Volunteers can really, really help. And it's going to be so fantastic. And of course, spiritual organizations, they can also be nice collaborators with you. As I mentioned, it's my personal opinion that, you know, when it comes to this or that mission or preaching, how they may help or, you know, vice versa, harm. But at the same time, these organizations can be helpful and they can be volunteers, pretty frequent ones, but depends on how you agree with them, how you clarify these points. Let's move on. Let me see. One more point. I'd like to pay your attention to this. The patient wanted to smoke. This is the question on how you organize the patient's work. There is still a chance for patients to smoke, and there are smoking volunteers. There are volunteers who smoke with some patients. You need to be skillful in smoking. Of course, it's not described as an entrance criteria, but there is this story of smoking volunteers who co-smoke with our patients. Okay, a couple of schemes that I wanted to share. And I'll again share the source where it comes from, but I think it's an important scheme because this is the volunteering structure, and the scheme below, the lower one, it's how the organization works. What's interesting here is, as you can see, there are tutors who teach. There are deputies, secretaries, leaders of teams, volunteers. What does that mean for all of us? How is this scheme cool? That there is a learning, there are secretaries or administrative workers who cover legal backup, etc. There are team leaders who are under the team leaders. It's so cool when you have small volunteering teams. A certain part does Padzu corner. the others do cleaning, the others do communication. So you can share the streams of your volunteers if you have many, for instance, and if you have some responsible people. So it's not everything that you do yourself, and you're not again closing everything yourself, and it's not that the one leader is leading everyone. And the scheme below is how the organization works.
And so below, you can see the structure of a medical organization with a volunteering unit. So volunteers would be part of this organization and not just invited guests. Well, you will tell me, and I would agree that quite often Palliative Center is a government-owned center. So it's a public one, it's not a private one. But I also worked in a hospice in Moscow, and 20 years ago, there were no foundations, there were no coordinators who would be working with volunteers. And people understood that they really had to get some additional help because there were a lot of tasks to solve. And then the nurses themselves and social workers were the coordination center for volunteers. I don't think that's the very correct version of how it should be working, but just for the beginning, to train the first volunteers to start this helping, I think that it's quite a good solution. And that was the first step for us back then. But now there are a lot of special volunteering units. And we also need to understand that it's all work in progress. It's all about development. 30 years ago, in the countries where we live with you, there were no hospices. 20 years ago, there was no charity organization or charity culture. And now we are also working together with you to build the foundation, element after element of this whole system. I know that it's difficult, but I'm sure that if we continue doing this, we'll make it happen. And what I've heard from you today, it inspires me. And I'm really sure that we will succeed together. So now let's move on. Let's talk about training. We already discussed that the volunteers can perform different functions and tasks, that we can trust them and give them a lot of work. But of course, we can't just leave them without training. There is a problem, which is not on all countries there are palliative professionals, but still doctors train for many years to become a doctor. Uh, and volunteers are people who just work because they want to work, that's it. But volunteers should also get training. And this will be the last question for our discussion. Maybe you had something in your practice already. What did you have to teach to train your volunteers in the field of palliative care? Maybe somebody would like to comment. Or you can also just write in the chat. Is there any necessity to have like a formulated training program? Because this maybe is something for the coordinators of volunteers in the future. Yes, please. I see you raise hand. The floor is yours. I would like to share this is something that we remember for a very long time, as well as our patients. We have a daily care center. It's already turned 1 year, so we established it 1 year ago. And patients can come to the center, those patients who can walk. This could be patients with cancer or any other disease. They can also come with their relatives. And since last year, we got an initiative. Some volunteers wanted to come to our center to teach our patients to do different things. Maybe some bouquets from dry flowers. And we organized the events like this. And we also have in our country the International Women Club that involved wives of the ambassadors of different countries that are stationed in Moldova. And within this workshop on flower techniques in our center, the visitors showed what they could do. And so every visitor trained one patient. And so they got everything ready, everything that they needed to have. And so we got very, very nice souvenirs after this, some compositions of dried flowers. And all our patients remember this experience. Yes, thank you very much. And it's very interesting to hear about what volunteers can teach patients, of course. Actually, such organizations as the Women's Circle involving wives of the ambassadors, it's quite a common case in a lot of countries. And it's very nice that you made those flowers or ikebanas, as we also call them. And it's very nice that people who actually grew in a culture where volunteering is quite already established, it's very nice that they can also bring this experience to some other countries where volunteering is just being developed. And so, thank you very much for this comment. We would also like to discuss what should we train volunteers in if volunteers come only for one time or maybe for multiple times. What shall we train this volunteer in to enable him or her to deliver on the tasks? And if we don't have any comments here, then I think Felix can also share his vision. Yes, sure.
Чем мы его... Так, секундочку. Так. Так, все перешло обратно. Давайте начнем. Сейчас. Да. Да, как я уже сказал, ранее медикам...
So, let's see. As it was already mentioned, doctors are trained for a long time, but a volunteer doesn't have any training. Of course, we can't train a volunteer in all the medical topics, but we definitely need to train them in something, such as the philosophy of palliative care. Also, some rules of a hospice. Also, we need to train them in principles how to establish communication with the patients and their relatives. Why is it important? It's important because not everybody knows maybe that should you say hello when you come to a hospice? Well, some people would say yes. It's also a peculiarity of Russian language. Because in Russian language, when we say hello in Russian, it means actually we wish you health. So in Russian, we try to replace this with another greeting like good day, good afternoon, etc. So it's a matter of communication. And of course, we need to train volunteers in foundation and the rules of how to work with some technical equipment, some lifters, the function-based bed for a patient, how to feed patients, how to work with a chair, whether to apply brakes in a chair or not. Well, I think my colleagues are quite aware of all this because we really need to be very careful with this and to monitor this very closely. And when we train volunteers, I think I'll also follow up with some additional materials on this in different languages. And after our workshop, we'll add this in the materials. So we'll add some topics on education and training. Now let's talk about some rules and cases. As you know, any rule that is written down is inspired by some problem. Well, of course, volunteers are great, and it's very nice that they would like to help, but they also should abide by some rules when they come to a hospice. I started with the rules that I was respecting with all my volunteers myself, but then I shortened this list to just three main groups: the rules of the facility itself, second one is the law, the legislation, and the third one is the code of a volunteer. Let's discuss a case when a volunteer comes to the facility and there is no coordinator of this volunteer. Quite often when we start working with volunteers, we don't really have that much time to be able to give our volunteer all the time that we have. For example, if a volunteer would like to come at night, then, well, obviously we want to be able to be present, and we don't usually allow this. Also, as I said, we should have some special health certificates for the volunteers. They should have badges. They should also wear some particular type of clothes. Then, when it comes to legislation, of course, it's obvious that we need to respect them. Some colleagues have mentioned today that there is no law on volunteering help. So I can't really recommend you anything on the laws in your country, but still it's a very important aspect to remember about. And the third one is the code of a volunteer. This is your own code for your volunteers. This is a moral code. Uh, Generally and quite usually, when people come to us, they probably have some mission, and we really try to work within the single or unified philosophy. We would like to have like a unified code to make it good for a patient.
Признать самый главный факт, что есть такая вещь, как прощание с
It's
волонтером.
very important also to remember that we have such an event as a farewell to a volunteer when our volunteer leaves. There could be two reasons. A volunteer can leave because of his or her own reasons. For some time, a volunteer can keep coming, and then he or she can say, "Okay, that's it. I've done everything that I wanted, and I'm not really inclined to helping anymore." So there are some volunteering cycles. Usually people go in such cycles as 3 months, then 1 year and 3 years. So they usually leave, judging by our experience, after the end of one of these cycles. We need to remember this. And the second reason why a volunteer can leave is because he or she violates the rules of the facility. If this happens, then we need to say goodbye to this volunteer. We should say, "I'm sorry, but you're not fit for us." For example, if a volunteer exchanges mobile numbers with the patients and then calls or maybe he or she issues some recommendations in the medical field. So this is a no-go for us, and we should be able to say goodbye to this volunteer. Maybe it's the best volunteer, maybe he or she helps a lot, but if it violates our code of volunteering, we should say goodbye to this volunteer, because we don't know how it will damage our work and the life of our patient in the future. And to conclude this presentation, I'd like to talk about these three wonderful books. Those are very nice materials. The first two ones are by Doyle. This is also one of the organizers of a hospice aid and care. He also built the Christopher Hospice in London, and he also got the experience from Silly Sanders. And so we will also share the links in our chat. The first book is called From What to Start. You know, it's when you need to know like how to do everything quickly. And so this book just explains all the advantages and disadvantages of volunteering in hospice, etc. And this author has another book which is called Volunteers in Hospice and Palliative Care. This is a very good handbook for volunteers in palliative care. So there are a lot of graphs, tables, rules, surveys, questionnaires for the volunteers. So you can follow all the steps according to this book. And I really recommend this. And another one, a couple of years ago, my colleagues from the Vera Foundation also put together a brochure about volunteering in hospice. It's quite similar to the work of Derek Doyle, but it's a bit a newer work, and you can also get a lot of interesting information from that. There are also the templates of contracts, and there are some described in detail aspects on how to work with volunteers. So I would recommend these three books if you'd like to start to work with volunteers. And I think that's it from my side. And now I'm ready to discuss some questions that we probably got in the chat. Yes, Felix. So we've got some questions that our colleagues asked during the webinar. And dear colleagues, if you have any questions while we're answering the first ones, you can ask them in our chat, or you can just unmute yourself. First, please raise your hand, and then we will give you the floor. Okay, thank you. So shall I start answering the questions? Yes. What are the main risks of working with volunteers in a hospice? Okay, that's, yes, quite a big question. As I said in the beginning, volunteers is a great help, but it's also a huge risk. So volunteers is a discovery for the hospice world. Why? Quite often medical staff is afraid of volunteers because volunteers kind of like open the facility to the world. The hospice becomes more open. Well, for medical staff, it's a bit difficult because some parallel life is getting into their medical life in the facility, and a lot of people don't like it that much. And from the volunteer point of view in a hospice, well, as I already said, if we have an untrained volunteer, then of course it's a risk for this volunteer, first and foremost, because if he or she helps too much, doesn't really control himself or herself, they can just face a burnout. Another, for example, case is if a volunteer wasn't really trained how to feed a patient, and then he comes to a patient, and this patient has an agglutation or dysphagia, then it's a risk. Also, if a volunteer hasn't been trained how to apply brakes in a wheelchair. So this could also be the risk if a volunteer is not trained. Another question, can a volunteer help with money and some financial resources, and not only with his time, skills, and competences and knowledge? Whether it's ethical to help with money. Well, I think that we need to distinguish here. There are just volunteers, but there are also like charity volunteers, and there are also fundraisers. So we have different groups of volunteers here. And so this is the subgroup of a volunteer. I mean, volunteer that helps with money. I actually also give some money sometime, like donate, or I also can do some work myself. Well, quite often manual work is even more important. Like manual help is more important than financial help. How can we prevent a volunteer from being burnt out? Well, it's another question. It depends on the situation and a person. Quite often, I saw this, and I'm just like this myself. When a volunteer comes to a hospice and then works there 24 hours, 7 days a day, and a lot will depend here on the coordinator. The coordinator should tell the volunteer that he or she should come only 3 days per week. So the coordinator should also limit the time that the volunteer spends in a hospice. And also it's a flag for us, and we need to think whether it's a good volunteer for us or not. Maybe the volunteer doesn't have any life at all. How to also avoid burnout, maybe to change the field of activities. For some people, hospice, especially for people who have very difficult work, hospice is a kind of like a change of activity. But we should also organize some events for volunteers to avoid the burnout.
Please do these support groups. You may facilitate these discussions so that these volunteers could really speak well, share their thoughts, share their worries. It's really important to have somebody else, not just you as a volunteer coordinator, who could hear the problems and concerns of your volunteers. There are some additional options to support, such as peer-to-peer support groups, etc. It really protects from burnout, like in any activity, honestly. Okay, and the question to Felix: how would a volunteer feel like a part of a team in hospice? It's a very complex question, a big one though. What I did was that I tried to make sure all volunteers feel that all information is shared transparently, so that they get all the information on all the updates about the new rules of the hospice. We had some joint chats where all the information was always available, and all requests were all visible to everyone. It wasn't that I had a favorite volunteer and this is the only person who gets my tasks. No, everybody has the rights to get these tasks and could give it a try and perform using different activities, helping in different teams. Volunteers should also be introduced to doctors. They should be taught, and they should be introduced to doctors in a sense that the doctors should be explained who volunteers are, etc. So I mentioned this earlier about the communication between volunteers and the doctors and the medical staff. We did a lot of joint activities. We did a New Year celebration. Yes, thank you. We did some other activities, some celebrations together, so that we join all our activities for some important events. When we do these events, we welcome everybody, not just the medical staff, but volunteers as well. This is the very last question, and we are approaching the end. How can we make sure that we know when the volunteer gets very close to a burnout? Well, that's what I mentioned earlier. In my practice is this following. A person covers their problems by a hospice. They try to help someone without helping themselves. They spend many hours in a hospice. There were volunteers. They came Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. These are big questions, I would say. These are red flags that we should keep in mind. If you text to me personally, if you have some questions that I didn't answer, or maybe you have a case in mind, I think we'll be able to review them. It's hard to speak without any details. Yes, thank you, Felix, so much. I'm sorry about that, Nastya. Yes, I think that a lot of things that you've mentioned gives us already a very good start for the development of this topic. And the questions that you guys asked and your experience, Felix, and the experience of other colleagues who have been speaking today, some of these cases I'm sure we will consider in the following webinars. What I want to say right now. So thank you very much, Felix, for the fact that you shared your experience and you're even ready to share your cases and stories. This is fantastic. We will give your contacts. We can always even just use this general email that we have shared. And thanks, dear colleagues who have been our invisible support, who helped us this webinar. I'd like to start with our interpreters. Thank you so much, Anna and Christina, for making the information more accessible, regardless of the fact which language a person prefers. I hope that the team of interpreters will also be supported by the interpreters of other languages, so that we could have more and more people who find other languages apart from English and Russian more accessible. We will have them fully incorporated. I'm sure it would broaden the scope of people who develop our community. And also I'd like to thank the team of PASTE, Roman and Irina and Ksenia and Elena. They are all from different parts of the world. They've connected, they help us, and all the team of PASTE works here to answer your questions and your needs. So guys, regardless of the question that you heard, if you have any ideas or thoughts on what could be helpful, for instance, all my colleagues would have valued this information, or it would have been so helpful to go on an internship to another country or to learn within a certain study group, different questions on either preparing and training your medical staff, doctors and nurses, as well as training organizational and administrative workers for the institutions. They're all very welcome. All your thoughts are very welcome. The requests are very welcome. As much as we can, we'll try to support you. When you are inside 20%, 200% into the routine, it's very hard to find the resources and time for development. This is so hard. That's why we have PASTE to support you. If you have something to share, welcome, please. I see how much you have to share. It's really a lot. Please let us know about that, okay? I see the messages in the chat. Let me see if there are some important things. Yes, there are some important moments. After every webinar, we collect feedback. Even if you really want to say it was terrible, horrible, never do it again, please fill in the questionnaire so that we could easily take this into account. This would be very helpful. And I see a hand raised, so please share your thoughts and comments. I think this is the hand raised from the previous Q&A session. Okay, never mind. I just really didn't want to keep anyone unnoticed. As for the following steps, on our website, you will definitely have this little note about the event, the minutes of the event, as well as the webinar available in 2 languages on our YouTube. In the website, you can get the subscription to the digest, to our newsletter, with some very quick news and updates from the world of palliative care globally. If you're interested to join the chat of palliative care professionals, it's absolutely doable. Fill in the questionnaire. We'll be happy to introduce you and welcome you there. Any questions, comments? We are very happy to support you, or at least react as much as we can. This is it. Apart from some long and complex webinars, we tried to organize that in a very brief manner, just 90 minutes, but I hope it was informative. At this point, I want to say thank you. And in August, we'll do a little break. See you in September. There will be a number of webinars in September. We'll have some advertisements for them. And thank you once again for your support and help and engagement. And see you in September.